Good morning, everyone. Thank you so much. I'm so thrilled to have the opportunity to talk with you this morning. And a round of applause to you for being here on a Saturday morning to learn more about PSP, CBD, MSA, and all of the conditions that we take care of. So my name is Jori Fleisher. I am a movement disorders neurologist at Rush University in Chicago. So I'm going to give you sort of a quick drive-by through a lot of different helpful tips and tricks that I have learned directly from my patients and their care partners. Just as disclosure, I am not affiliated with any of these products or companies. These are all things that I have learned about from patients, caregivers, and often from our physical therapists and occupational therapists. So this presentation, if it seems like it should be given by an occupational therapist, you're probably right. But I know that depending on where you are in the country, who you see, you may not necessarily see a physical therapist or an occupational therapist to get some of these kind of troubleshooting tricks. So my hope is to bring some of those to you to make daily living just a little bit easier. So with that being said, we'll talk through some tips for handwriting, for food preparation and eating, for dressing, transfers, meaning getting up from a bed to a chair or chair standing up and vice versa, tips for hygiene, toileting, communication, dealing with orthostatic hypotension or that drop in blood pressure that can happen when you change positions, and medication adherence. So let's talk about a couple things about handwriting. So you may have noticed with PSP and related conditions that handwriting can change. And for some people, not such a big deal, but for other people, it's really bothersome. And our handwriting and our signature particularly means a lot. And it's a stamp of our individuality. So what can you do if your handwriting is changing? Number one, for that signature issue, if you go to almost any office supply store, copy store, even online, you can request one of these stamps to be made. And essentially what you do is you can practice as many times as you want, get your signature right, and then you send that to them or you scan it to them and they will make a stamp for you so that when you're signing off on bills, when you're signing off on holiday cards, you can have your signature the way you want it. Makes it a little bit easier and you don't have to fret if it doesn't look exactly the same as it used to. If you're someone who's doing a lot of typing, using the computer pretty frequently, there are any number of different dictation softwares out there, and they are worlds better than they were even 5 years ago. We use them to dictate our medical notes frequently. So Dragon is just one example. But there are a lot of different softwares out there so that if you're noticing that stiffness or slowness are getting in the way of your typing or tremor, these are easy ways to get around that. And I show this mouse, and it may not apply to very many people, but I did have a patient who was actually, he noticed his tremor at first because he kept replacing the mouse in his office at work because he thought that it was faulty. And the next one was faulty, and the next one was faulty because every time he would try to use his mouse, it would click all over the place. And it turned out that his little finger, his fourth finger, was kind of clicking without him realizing it on the cursors. And so he actually drilled a tiny little hole in the side, put a little paper clip in there, bent it around, and made himself a little tremor finger rest. So does this apply to everyone? No, but I thought it was a really good example. It's part of what spurred the entire idea for this talk is people are able to MacGyver their way out of so many situations and find little tiny tweaks to make life easier. So if there are devices that you use or things that you do that you find are really challenging, you don't have to just accept it. Think creatively, ask care partners to help you think creatively. So it may just take a paperclip. What about food preparation? I think this is especially relevant as we get towards this strange and unusual holiday season that we are facing. So chopping things, slicing things can be really difficult if you are feeling more slow, more stiff, more rigid, if you're having trouble with coordination. So there are some simple and easy food chopping prep devices that aren't even electronic. You pop your vegetables in there, and especially if you're making a soup or something where the cuts don't necessarily matter and you're not going to notice them, you can pop something in there and you just pound on it a couple times and you're done. Also, if you have a food processor that's just gathering dust in the back of your closet, dig it out. You try out some of those different discs and blades. You can slice things, you can dice things a whole lot easier than using a knife for some people. And these were ideas that came to me from someone who had a pretty significant tremor and would notice that as he was walking into his office at work every day, he was kind of juggling his coffee in one arm and he was holding his keys and maybe a briefcase and a couple of other things. And to get the key into the door and not spill the coffee everywhere and not drop the keys on the floor and then have to bend over was really a task every day. And so he asked his office staff and got permission, and he put a little shelf just right outside of his door so that he could set the coffee down and set the other things down and just be able to focus on that one thing. We know in these conditions that multitasking, even things that didn't used to seem like multitasking, really demand so much more of your motor skills and of your brain right now. And so, can you offload some of those tasks just by setting the coffee down on a shelf, by setting something else down? So in your home, this might look like having a table close to the door, so that if you need to bend down and take your shoes off, if you need to sit down, you don't have to juggle all of the other things. Just simple strategies. What about eating? So I think there are so many awesome products that are not billed as things for people with neurologic disease. They're just things for people. And I think these can be really helpful, make the eating experience and meals much more smooth. So one thing is plates with rims. So if you have a tremor, if you're slow or stiff, it can be really difficult to get food sort of off of a plate and make that turn at the end of the plate to make sure that it stays on your eating utensil and doesn't go off the edge of the plate, right? But if you have a plate with a rim, you use that to your advantage. You can kind of scoop something onto a spoon or onto the fork without losing it. So plates with rims are great. The other thing is you want to keep that plate from sliding around on you. So there are a lot of different placemats that are made out of silicone, which means they'll stick pretty well to your table, whatever surface it is, and the plate will stick on that. And so you don't have to get one with cartoon, characters or anything on it. They actually make some really nice ones that look just like their regular placemats, and only you need to know that it's actually helping you. These are other tips that I learned from patients, which are that it can be really difficult to use a knife and a fork, especially if something is a tougher piece of meat or, cutting through a piece of broccoli, for example. But a pizza cutter here on the left, or what's called a mezzaluna or a rocking knife. These are really great utensils. You can find these at any kitchen store. You can find them online and just order them. They make it really easy to cut through more difficult things. So don't be afraid to try those out. And then the nosy cup. I don't know if people are familiar with this, but it can be very difficult for a lot of different reasons to do what we take for granted, which is raise a cup up to your mouth, take a sip. Right? And that could be because of stiffness and dystonia in the neck with conditions. It could be because of trouble swallowing, and that you may be better at swallowing when your head is sort of level with a surface. But then when we try and do that, our nose gets in the way. So people brilliantly created this nosy cup, which has a cutout for your nose. So you can bring the cup to your mouth and tip it, and you're not bumping your nose up against the cup. Really great for people who have difficulty with swallowing. And then socks. Socks, let alone compression stockings. So socks are really difficult to put on for any number of reasons. It requires a lot of fine motor dexterity. Tremor gets in the way, slowness, stiffness gets in the way, ataxia, apraxia, all the different sort of neurologic terms that we throw at the different symptoms. Those can all get in the way of putting on socks. Bending down, sitting up, can lead to some orthostatic hypotension or dropping your blood pressure. So this is just a screenshot of what happens if you go to Amazon, for example, and you type in sock assist. You can type in sock helper, you can type in sock device. There are about 10,000 of them, and they're all a little bit different, but they're pretty inexpensive and usually things that you can wash. And these can be really helpful. If the first one doesn't work for you, try another one. But people can frequently, especially with PSP, with MSA, because of the stiffness in your core, if you lean forward to put your socks on, you may keep going forward and wind up on the ground. So get a little bit of help to prevent a fall. Also, a lot of times people struggle. This is a very common and early sign of Parkinsonism, is people struggle with teeny tiny buttons or teeny tiny zippers. That real fine motor dexterity is very challenging. So there's a company started by a woman whose husband actually had early onset Parkinson's, and she recognized that this was a challenge for him, and it was a source of embarrassment that he wouldn't be able to get those buttons. And so she sewed the buttons into the side of the shirt, and underneath them, she sewed teeny tiny little magnets. And so the shirt looks like any button-down shirt, but you just slide your arms in. The cuffs close by magnets, but look like there's a button there. The front of the shirt closes by magnets, but you see the buttons there. So no one will ever know that it's anything other than a regular standard issue button-down shirt, but you will be able to get it on and off much more easily. And so there are several companies that do this. That company is called Magna Ready. But if you look up adaptive clothing, that's the term, search adaptive clothing online and you can find any number of these. And they've expanded to women's clothing. They've expanded to pants. Costco online, for example, used to have a line that was available. There are many different lines of clothing for any kind of thing that you need. Also, I can't tell you the number of times that people come into the office to see me, tell me that they're falling pretty frequently, and I look down at their shoes. And their shoes are not ideal. So when you have shoes that look like this, without some support and without a back to the heel, it's very easy to kind of scuff forwards and shuffle forwards, and that's a recipe for falling. Instead, we want a shoe that has support in it. But here's the problem, is that trying to get on a standard issue tennis shoe or sneaker is really difficult because then you need to bend down, you need to tie it, right? So if that's a problem, if you don't have someone who can help you, there are all kinds of shoe companies now, brilliantly, that have created shoes that you put on the ground, you step your foot into, and the back of it around your heel kind of pops down and pops back up around the back of your heel without you having to do anything. They're really built for folks who have a hard time bending down and putting on shoes, but still offer the same support, and they look pretty good, that other sneakers would. So check those out. And yeah, Amazon and Silverts.com are great resources to look for some of these different designs for adaptive clothing and shoes. All right, so what is the plastic bag trick? That was the title of the slide. I hope I'm not overselling it. But when I was in fellowship, learning to be a movement disorders neurologist, I had a great colleague, and what she told me was that a lot of people have a hard time getting up out of a chair, getting up out of the back of a car seat, and the simplest thing to do is take one of these throwaway shopping bags, keep it in your purse, keep it in your wallet or a pocket, and when you go to sit down on something low, you put it underneath you, under your behind, and it takes away some of the friction. So it's easier to scoot into that chair, to turn, to move around, and then when you stand up, it makes it easier to turn and to pivot. You pick it up, you take it with you, no one is the wiser. So there you go, you probably have a bunch of them stuffed under the sink or in a closet. Other things that make it easier to get in and out of the car. This device, which looks like this, if you search for car assist handle or car cane or car assist cane, almost any combination of those words will get you there. This, you wedge into the little latch to lock your door, and it provides you with a handle, with a lever, so that if you have trouble getting in and out of the car, you can push down on that and get yourself some leverage. Those are fantastic, and they're usually less than 15 bucks. Also, a seatbelt extender. What is this for? This is not an extender because you need a larger seatbelt if you're a person of larger size. This is that it's really hard to reach over and get the seatbelt if you're in the passenger seat, for example, to reach because of shoulder stiffness and core stiffness, to reach and turn and then get it down into a seat. And so if you are struggling with that, or you're a care partner and you're struggling with buckling a seat for someone, you can get a seatbelt extender like this. It basically plugs into the existing seatbelt, and it's fairly rigid. And so it makes it a little bit easier. It gives you about 6 inches less to have to bend and struggle to get that in for you. Similarly, getting in and out of bed can be a big challenge. And so having a bed cane There are lots of different models, and they really depend on the type of bed that you have. But if you search bed cane or bed rail, you can find some of these, and it makes it easier to turn over in bed, to get comfortable, and to get in and out. And one simple idea this happy model is showing us is either silk or satin pajamas or silk or satin sheets. They make it easier to turn over in bed, to get comfortable, but this comes with a warning. You heard it here first. Do not get both. Having both silk and satin pajamas and silk or satin sheets is a recipe for sliding out of bed. So we need some friction, but that can make things a little bit easier. Hygiene wise, it can be very difficult to brush your teeth and sort of maintain that rhythm. So let someone else do it for you, right? There are all kinds of different electric toothbrushes. Similarly, there are electric razors. Men, I know that this is a source of contention, but you can make the switch. I've seen it happen. It still offers a good close shave and can be really helpful. And one other product that I learned of from a care partner is this, which is called the Gillette Trio. It's actually a razor, and it's the first one that was designed for care partners to use when shaving someone else. So most razors are designed to be held in the hand of the person who's doing the shaving, but this is not. And this, I guess the blue gel inside is actually sort of self-contained shaving gel. So you can just kind of use that, and I've heard pretty good feedback on it, but I've not used it myself. All right, what about toileting? If constipation and straining is an issue, one of the simplest things that you can do is to place a step stool underneath the toilet to raise your legs up a little bit. And just by changing the angle of your hips and being more in a squatting position, that can help relax some of the pelvic floor muscles that need to relax to be able to have a bowel movement. That can be really helpful for folks who are struggling. Similarly, for nighttime frequent urination, especially in our men, having a bedside urinal or a portable urinal like this, just one of these little jugs, get one with a lid, try it. It's not anyone's ideal, but this can really save you from getting up back and forth to the bathroom every night. The time when our folks are most likely to fall is getting up and back to the bathroom in the middle of the night. There's all kinds of reasons for this. And so if you can prevent that from happening, that is incredibly helpful. One of the other things to know is that urinary tract infections get more and more common with age and as these diseases progress. And so anything that we can do to help keep the genital urinary issue clean is really helpful. There's some evidence that things like bidets can be helpful, and you can have your regular old toilet outfitted. You can sort of add on these funny little bidets. They come with all kinds of kitschy little names, but these can be helpful, especially because the actual act of wiping can get more difficult as time goes on, and people may not exactly remember which direction to wipe, especially in women, and that can lead to kind of seeding of bacteria. So these can be really helpful options. Finally, if communication is getting to be an issue, there are these fantastic books that can be really helpful. Sorry, I just want to make sure I'm not running out of time. These books that are helpful and show us if you're having a hard time getting words out. They're essentially picture books. They're meant for travelers in another country who don't know the language to be able to flip to a page and say, this is what I want. This is what I want. But especially in folks with PSP or cortical basal syndrome, this may be really helpful to have on hand, sort of like a communication board, but it's a pretty quick and easy solution. And these are available online. For orthostatic hypotension, those drops in blood pressure when you sit up or stand up, one of the best ways to work on preventing this is by sleeping with the head of your bed elevated, at least 30 degrees. And that's really tricky to do just by stacking pillows. People tend to kind of slump off the sides. So if you get a bed wedge pillow, that can be really great. These are available online and at durable medical supply stores. But one of the tricky things is if, especially, you've switched to a satin or silk sheet, they might slide all over the bed. So quick and easy trick is to get a pool noodle, one or two of them. These are those long styrofoam noodles. Sometimes they sell them at the dollar store. If you put one running lengthwise along the edge of the bed and you stretch the sheets over that, makes a little lip. And then you can put your bed wedge pillow on top and it's not going to slide off the side. Hydration is really key. For the sake of time, I'm going to skip over this. Medication adherence. It's really hard to remember to take medications at the same time every day, especially if it's multiple times a day. So as much as you can link a medication dose with a regular activity that you do, if it's a morning medication, brushing your teeth or making your coffee, or reading the paper, keeping things where you know every day you're going to do a routine, that can be a really great reminder. And then low-tech reminders, setting sticky notes, that can work really well. Middle kind of tech are pill boxes with built-in alarms. So I'm not sure if I have a picture of this, but I like this one. This little box basically fits in the palm of your hand. And if you flip it over, the back of it has 4 little pillbox compartments. So you can set 4 different alarms on it. You can make it ring or you can make it vibrate. It fits in most people's pocket. And you can set it for up to 4 different times to take medication. So it can be really helpful because I don't know if you're like me, but if I set a phone alarm to go do something, the alarm might go off, but if I'm not in the same place as the pills or as the thing I need to do, I'll hit snooze or I'll turn off the alarm and think I'll get to it in a minute. And sometimes that doesn't happen. You can also set your phone alarms, and most phones, even if it's not a quote unquote smartphone, can be set. So if you don't know how to set an alarm on your phone, I would say ask your nearest kid or grandkid. They tend to be pretty good at it. You can set these for multiple times a day. You can even label them as, I'm going to take this drug at this time. There are also apps that you can use on your phone to connect you to your pharmacy so that it can make getting refills easier. In case you have concerns about interactions for drugs, that can make that easier too. So there are lots of apps out there, most of which are free. Finally, if you have medicines that you take regularly, try to always keep an emergency supply in your purse or your wallet, your glove compartment, and not that many people are traveling right now, and you shouldn't be. But if you are traveling, always keep your medication in your carry-on bag. Putting it in your packed luggage is pretty much a guarantee that they're going to lose that bag. Finally, ask an occupational therapist for other ideas tailored to your life. I cannot sing the praises of our allied healthcare professionals highly enough. They are our troubleshooters. So with that, I will open it up to questions, and I thank you so much for your attention.
Thank you so much, Dr. Fleischer. Can I tell you my trick for reminding myself to take my medications?
Yes, please.
Okay, I always remember to give my cat a treat at the same time, because if I forget to give my cat a treat, she will definitely remind me. So if I forget to take my meds, the cat will remind me to give her her treats. So
that's amazing.
So in the meantime, do we have any questions from the audience? I'm going to read out one that was pre-submitted. Let me pull it up here. One question that came in was how to manage family members with the disease when so many of them are across the country. Like, how do you bring them into the fold for help with the patient?
I think the question is, like, if there are, family members who want to help with someone, who's sort of in one central location, and the other caregivers or family members are elsewhere. And I think, that's a really tricky question. It's a really great question, and it's a really important question for this moment in time. So I think finding really concrete things to ask them to do. So if you're the primary care partner, for example, and you're living with your loved one with PSP or MSA or cortical basal, it's really hard to get out and get groceries, right? But can you give a list or make a recurring list of groceries? And maybe that loved one that's, 2 time zones away can set up Instacart or another grocery delivery service, and they can just handle it. Right? And they'll set it up so that your groceries just show up on your doorstep and you don't need to think about it. You don't need to go. Can they be in charge of drafting a list of questions for the next doctor's appointment, right? Maybe, you scratch out a couple of things, but if they have questions about research or things like that, they're not directing that to the primary care partner who's really doing all of the day-to-day 24/7, but say, that's great. I'd love to ask the doctor about all those studies that you want to send me. why don't you just make a quick bulleted list? I think asking, and especially now as we're transitioning to much more telemedicine for visits, which I think, is maybe one of the silver linings that's coming out of COVID. Asking the physician, can we loop in, my daughter, my son, or, any of these other family members who might want to be part of the visit. For some platforms, there are ways to do that. So that, you can have a lot of people on a visit. So everyone is hearing the same thing. And it's not on that primary caregiver to convey, okay, this is what was talked about and this is what was talked about, because they don't have time for that.
Thank you so much. Someone would like to know, she has some issues with toileting, and you mentioned some devices. Could you please repeat them?
Sure. So the device that I mentioned for issues with straining, especially with constipation, is called a squatty potty. They gave it a great name. I think it's around $20 or $25 and usually is on Amazon or Bed Bath & Beyond. So if you have a bunch of those Bed Bath & Beyond coupons that pile up in the mail, use it for that. There are plenty of other step stools that you could use. It doesn't have to be that one. The only things to keep in mind with that are you want to make sure it's not going to get in the way and be a fall risk in itself. So the reason that we like that one is because it actually sort of fits around the toilet and it's got non-skid bottoms. So you want to make sure it's not going to slide around on you. There are plenty of other tips and tricks for constipation. If it's more of a slow transit constipation, that things are really just kind of building up and getting stuck. For those, keep in mind that things like Colace and Senna and Dulcolax, those will all work for a while, some of those over-the-counter stool softeners and laxatives, but after a while, most people's body gets used to them. So switching over to something like Miralax, it pulls more water into the gut. It helps kind of flush things out. So that can be a helpful switch.
Thank you. All right, we have time for just one last question. What is your suggestion for coffee drinking if you're so rigid that it's hard to hold a cup and bring it to your mouth? She couldn't find a spill-proof mug that was also insulated, as her mother doesn't have the coordination or strength to press the button on a travel mug.
That's a good question. I haven't thought about that one before. I think the easiest answer would be, is she able to switch over to iced coffee, or to room temp coffee, just so there's not that risk of burning? And then, switching to a straw potentially, or putting it in that nosy cup, so that you don't have to burn, you don't have to tilt backwards or forwards. That is a great question. I will go back to my experts and ask some of our OTs and our speech language pathologists if they have any ideas of how to do hot coffee in folks that have those issues.
All right, thank you so much. We're out of time, but we really appreciate you being here. This was really wonderful, and we loved all of the advice today. Thank you again.
Thank you so much for the opportunity. Have a great day, everyone.